Hello everyone, this is my introduction to COVID-19. My name is Eli Nganupoi. COVID-19 is a new disease that has not been previously identified in humans. Le COVID-19 est une nouvelle maladie chez les humains. It is caused by the coronavirus, a large family of viruses that cause diseases in mammals and birds. Le virus a une source zoonotique, and the COVID-19 is an infectious disease. The COVID-19 was first identified in December 2019 in Wuhan, the capital of China's Hubei province, and has since spread globally and to date is in 187 countries and territories. Le COVID-19 est détecté globalement et dans 187 pays. It was recognized as a pandemic by the World Health Organization on 11th March 2020. Now, let's look at the list of COVID-19 cases around the world. As of the 9th of April 2020, the USA is the most affected country in the world, followed by Spain, Italy, France, Germany, China, Iran, the UK, and so on. In Africa, South Africa is the most affected country, followed by Egypt. The Democratic Republic of Congo has 180 cases and 18 deaths. Voilà la liste des pays les plus affectés dans le monde, et en Afrique particulièrement la RDC. In total, there were more than 1.5 million cases of COVID-19 and over 85,000 deaths. It has been reported that hospitals are clogged with COVID-19 patients. Les hôpitaux sont engorgés de patients. Therefore, many countries are in lockdown with measures of confinement. Presque tous les pays sont en confinement. Looking at symptoms, human coronaviruses cause infections of the nose, throat, and lungs. Le virus infecte le nez, la gorge, et les poumons. Those who are infected with COVID-19 may have little to no symptoms, as symptoms are similar to a common cold or flu. Les symptômes sont minimes et comparables au rhume ou à la grippe. The main symptoms are fever and feeling shivery, continuous dry cough, fatigue, sore throat, headache, and pain in muscles and joints. Ici sont les symptômes fréquents. In severe cases, the infection causes difficulty in breathing and can lead to death. En cas sévère, les difficultés respiratoires peuvent être mortelles. For transmission, some details about how the disease is spread are still being determined. The virus is primarily spread between people during close contact, often via small droplets produced while coughing, sneezing, or talking. Le virus se propage au contact au travers des gouttelettes produites en toussant ou en éternuant. People may become infected by touching a contaminated surface and then their face. Les gens peuvent être infectés en touchant des objets contaminés et puis leur face. Strategies for preventing transmission of the disease include mesures de prévention, maintaining overall good personal hygiene, une bonne hygiène personnelle, coughing or sneezing into the elbow or a tissue and putting the tissue directly into a waste container. Avoiding touching the eyes, nose, or mouth with unwashed hands. Washing hands frequently, cleaning surfaces, and wearing masks. That's why countries have decreed lockdown or confinement in houses. Raison pour laquelle les pays ont décrété le confinement dans les maisons. Social distancing is mandatory and if infected, quarantine of 14 days. 14 jours de quarantaine. Therefore, we are urged to stay at home. Nous sommes invités formellement de rester à la maison. For treatment, there are no specific antiviral medication approved for COVID-19. Alors, pas encore de traitement. Yet, there are some recommendations for managing this disease. Recommandations pour gérer la maladie. Symptoms may be alleviated by resting and sleeping a lot, drinking fluids and keeping warm. Suivez les consignes des remedies. Most people with the coronavirus illness will recover on their own. La plupart des gens se remettront d'eux-mêmes. Thus, stay at home and if infected, quarantine for a minimum of 14 days. Restez à la maison. In the event of having difficulty breathing, go to the hospital for urgent medical attention. En cas sévère de difficultés respiratoires, allez à l'urgence de l'hôpital. Next time we shall talk in details about the virus and the disease, the various symptoms and other issues around this disease. Prochainement, nous allons aller en détail sur ces sujets. Thank you very much. À la prochaine.